Hi there. There are 3 types of ejaculation problems that exist among men. I know you are used to premature ejaculation and retarded or delayed ejaculation. The third one will shock you. Welcome back. We'll be talking about the 3 types of ejaculation problems men have. And the first is retrograde ejaculation. Normally, during orgasm or during ejaculation, the muscle at the neck of the bladder tightens and closes up, and then semen leaves the prostate gland through your urethra out through the man's body. But due to, let's say, a surgery, a weakness or weakening of this muscle, during ejaculation, this muscle at the neck doesn't squeeze or tighten or close that opening. And what happens is when semen leaves the prostate gland, instead of it going out through the urethra out of the man's body, what it does is it enters into the bladder instead. What are the signs that you have retrograde ejaculation? The first thing you will notice that when you as a man, you have ejaculated, you've reached climax, you feel like you have released, you understand, oxytocins and endorphins have been released in your body, the feel-good hormones have been released in your body, substances have been released to make you relax and just be yourself, and you're going into your refractory period. What happens is that you notice that you have discharge only a small amount of semen, so small, maybe just a drop. And in some men have no discharge. The third symptom is that when you go to pee, you realize that you have cloudy urine. And this is because the semen is in the urine. The semen now, in combination with the urine in the bladder, now comes out through the urethra, and that is how you notice you have a cloudy urine. So if you have a cloudy urine, know that you are experiencing retrograde ejaculation. If you are experiencing no semen during ejaculation or a drop of semen during ejaculation, then you are experiencing retrograde ejaculation. Though this may not be a problem to the man, it wouldn't affect his performance, his sexual performance in bed with his spouse. But what it's going to do that is it's going to affect his fertility, especially if he intends to make babies. So if you are in this category, please make way to see your urologist and your GP or a sex therapist so that you get the help you need. What are the causes of the retrograde ejaculation? Point number 1. If the man has taken high blood pressure drugs, blood against anti-hypertension drugs, and in this case, we're talking about the alpha blockers, these drugs in this category, and also if he's diabetic, he will experience this. If he has multiple sclerosis, he will experience this. If he has a weak bladder muscle, and if he has had any form of surgery around his bladder or his prostate gland, he's going to be experiencing this retrograde ejaculation. Make sure you see your GP, make sure you see your urologist or sex therapist if you're experiencing this. This may not affect your sexual performance, but it will affect your fertility in a long run. The second type of male ejaculation problem is the retarded or delayed ejaculation. And this occurs when a man is struggling to ejaculate, but he can't, and even when he has a good erection, and also when he's noticing significant delay during sex when he wants to ejaculate. I mean, this is something that happens often. It's not when it happens once, it's when it happens often. It's recurrent, and this is something that he needs to look into. What are the causes of delayed or retarded ejaculation? Now, there are physical causes and there are psychological causes. And we'll start with the psychological causes. Point number 1, if the man is taking antidepressant drugs, if he's taking antipsychotic drugs, if he has relationship issues, if he's not into the lady, if he is struggling to, if he has had bad relationships in the past, it's going to affect him. And also, if he is taking antihypertensive drugs. Now, on the physical side, what are the physical causes of this delayed or retarded ejaculation? Point number one, age. Age plays a major role. As you age, you're going to experience this. Secondly, if you have multiple sclerosis, if you're diabetic, if you've had any form of surgery around your bladder or your prostate gland, and also if you've had spinal cord injuries. So these are the factors that could cause a man to have delayed or retarded ejaculation. Now, the treatment for this is you should go see your urologist. Your urologist or your sex therapist is going to help you. This is not fun at all. Especially, it may spoil the mood for your partner and it may spoil your mood, And sometimes a man who has delayed or retarded ejaculation may actually ruin the sex mood with his spouse, because his wife, may be expecting him to come and he can actually be going for long hours and really struggle to connect, to ejaculate. So I would advise that a man should work on his psyche. Make sure you have a partner that you love. And this is why it's not good to have many partners. If you have had an abusive childhood, if you have had bad relationship, heal yourself. Heal. It's not going to help moving into the next relationship. Heal. If you have had a relationship where you were being assaulted, even as an adult, if you had a relationship where, let's say, a woman made you feel bad or she insulted the size of your manhood, you need to heal and be confident in yourself. And you need to engage with your partner. Speak with your partner about this and get help. Get help, because it will affect your sexual activity. It would affect your sexual activity. I did a video on this, on how to go multiple rounds as a man, the sexual refractory period, and I will leave that at the end screen. It's going to give you a lot of tips. And I'll also leave the video on at the end screen on how you can make your man or woman last longer in bed. I'll leave that at the end screen so you will be empowered and you will enjoy your relationship. I am here to help you. The last on our list is premature ejaculation. Now, premature ejaculation is well spoken of around the world, and many people experience this. And this happens when a man ejaculates before he even wants to. In fact, before he even wants to get into the mood, he has ejaculated. So this is very common, and I know that there are a lot of informations out there and a lot of health services that are put out there to help men. Now, what are the causes of premature ejaculation? There are two causes. There's a psychological and there is a physical. So we are going to start with the psychological. The first is the upbringing of the child. If you're from a strict home, you have very strict belief and you're being taught that sex is not a pleasurable thing, sex is just an act to have children, trust me, you're going to go into every sexual activity knowing that is just to drop your semen and let the woman get pregnant, or you still be living in fear that you shouldn't be having sex. Some religions and some beliefs, some cultures do inculcate this into their men or their children from a very young age. Point number 2, abuse as a child. Child abuse. If you have been abused as a child, it's going to be very difficult for you to really enjoy sex. You're going to be having premature ejaculation because every time you want to have sex, the flashback of these images are going to come back to you, into your mind, into your memory. And what I'm going to advise here is that you should heal. get help, get deliverance. If you're a Christian, speak to counselors. In fact, just be by yourself. And I think your spouse should know about this so she can best help you please her. The third point is boys who have been masturbating and while watching pornography from a very young age, and then they know that what they are doing, watching pornography or ejaculation and masturbating, is wrong. So while they are masturbating to ejaculate, they are in a hurry. So it has been conditioned in his mind from a young age, you know, to hurriedly, to do it quickly, to ejaculate quickly. So it becomes a habit to him. It becomes a habit. And when he grows up as an adult, even while married with kids, he's still struggling with that because he has been masturbating from a young age. And this is why in my previous videos, I spoke about, you know, pornography and masturbation messing up with your erection, messing up with your sexual health, messing up with your arousal, with your sexual desire. It really messes you up because it becomes like, it programs you then. It becomes like a habit. And the next point is relationship issues. If you have had bad relationships, heal from the relationship. Guys, heal from the relationships. Going into another one will not help you. If you have had childhood traumas, things in your life that happened while you were a kid that, you know, has affected you emotionally, has made you, has given you a lot of anxiety, has given you a lot of self-hatred. You know, this is going to help if you can heal, if you can go for deliverance, if you're a Christian, if you can speak to somebody who can help you, speak to your spouse who can help you. And most men who are into premature ejaculation struggle with anger issues. That's the truth. And the beat up, most of them, or some of them are battering their spouse, beat their spouses. It's the frustration. So if you don't know how to control this emotion, this thing that happened to you as a child that is affecting your relationship, if you haven't dealt with it, you won't enjoy any relationship, you won't keep any marriage, you won't even be able to communicate and have a healthy marriage. Talk about of a healthy sex life. The fifth point is depression. Depression causes this. Make sure you sort out depression in any form. The sixth point, anxiety. Any form of anxiety you're going through, anxiety can cause premature ejaculation. And the last point is stress. What I'm going to advise you is learn how to control your emotions. It's going to help you real well. Real well. Now we're going to the physical causes of premature ejaculation, and this is prostate issues, whether you have prostatitis or you have prostate cancer. The second point is if you're taking hard drugs, if you're taking heroin, if you're taking marijuana, if you're taking some form of drug that is playing hard on your emotions, has taken over your emotions, it's going to affect you. It's going to cause you to have premature ejaculation. If you're overweight, you're going to experience premature ejaculation. And if you have thyroid problems, if you have an overactive thyroid, if you have, let's say your thyroid gland is producing too much substance or it's less substance, you're going to experience this. So what are the treatments? I will advise that you go see a urologist. A urologist would be the best to help you. He or she will have to run some tests. And if a surgery needs to be done, it will be done. That the treatment will depend on the cause. And this is the same for the premature ejaculation, the retrograde ejaculation, and the delayed ejaculation. Their treatment or their solution will depend on the cause. So I advise that you be open to your doctor and open to your spouse. And this is why you need to be with a spouse that you trust. If not, you keep having multiple partners outside. You have to be able to open up to your spouse. And if you are a woman and you're watching this video, please Be open to your spouse. If you want to get the best out of a man to be open up to you, when he's talking to you, don't respond. Let him talk. And if he notices that you can take a lot from him, even his disappointment, without throwing it back at his face, he would tell you a lot of things. Men would only tell you things that you can handle. If he had an abusive past, he could only tell you that if you're able to handle it. So he would try to come towards you with a little things or some minor things to see if you can handle it, if you can handle his disappointment without judging him or without putting it in his face, he would open up more. So men are not like we women that we tell her everything. We are here to pour out our emotions. Men don't do that. They will just sit and watch. But if you want to really get your man and enjoy your marriage as a woman, make sure that you are silent and you're open when he talks. Just say, okay, we'll see what we can do about it. But you following him and saying, let's talk about this, why are you doing this, why are you doing it? He won't talk to you. Just give him the room to start a conversation, and when he starts, let him talk. And when he talks, you reach a point, even when he exposes his weakness or his disappointments, he wants to see if you can handle that minor disappointment of his. And if he notices that you're okay with it and you can flow with him without him making him feel less of a leader or as a man, he will open up more to you about his childhood traumas, about his relationship issues. So thank you so much for joining me into this class. And if you love my content, if you have just joined, if you have been following and you have been commenting, I want to say thank you. And if you love this content I've been dishing out to you, please support me by smashing that subscribe button, by commenting, and by sharing. And remember to turn on your notification bell. I remain your seasoned medical professional, Gwendolyn Halle. Bye-bye.